Hello and welcome to Dialogue. In China's first winter without COVID-19 restrictions in 3 years, hospitals in China have reported a surge in respiratory illness, especially among children in northern China. The World Health Organization has concluded following an investigation that the infections are caused by known pathogens. How concerning is the current outbreak? Does the situation mirror what happened last year in many parts of the world at the end of the COVID pandemic? And are the mitigation measures, such as mask wearing, to blame for the uptake of cases? To help us answer these questions and more, I'm joined by Dr. Alice TAN, internist at MizMedi Women's Hospital, and Zhiwei, professor and director of the Center for Public Health Research at the Medical School of Nanjing University, and Dr. Christopher Hui, consultant in respiratory and critical care medicine of COVID-19 task force. That's our topic. I'm Xu Qinduo. Welcome to Dialogue. Professor Wu, I will start with you. The question is like for people who are outside China, what is the situation on the ground? People do see pictures on the internet, for example, of packed hospitals or clinics, with young patients over there. So how serious is it?
Well, in the major cities, definitely this is the case. If you go into a children's clinic or children's hospitals, you do see a lot of kids actually getting sick, and they are attending clinics and seeing doctors. So this is actually a pretty crowded situation in many children's hospitals. I actually went around last week in some hospital in Nanjing, and you can see the situation is quite dire. You can see that lots of children getting sick. So clearly, this is the case. I think if you go outside of major cities, I heard that the situation is very similar. Not only the children, but the adults as well. And you can see that a lot of adults also getting sick. Like in my institution, you see a lot of young adults actually getting sick. They take leaves from the university. So I think this is a situation across the country, not only in northern China. I'm living in southern part of China. This is something which we haven't seen in the past.
Okay. Dr. Alice Tan, so, from where you are, if you look at the situation and the happening in China, and so what's your observation?
Here in South Korea, we are seeing a similar but perhaps not quite as dire a picture. In other words, during the 46th week of the epidemiological year, that correlates to the third week of November, we saw 37.4% cases of ILI, in other words, influenza-like illness. This is compared to same time last year, it was 13.2%. So more than a threefold increase. Typically, the ILI rates at this time of year are less than 10%. And so certainly we are seeing an increase in influenza-like illnesses in the community. We're also seeing an increase in serious acute respiratory illness cases as well, according to the KDCA, that's our health organization. There were 355 cases reported during the 47th week. That's the data from the last, most current data. This is compared to same time last year, it was 223 cases. In previous years, pre-pandemic, right around this time, it was 258. So we are seeing more both non-severe and severe cases of acute respiratory illness at this time of year. It is unusual. Of course, it's not at, say, pandemic influenza levels during the 2009-2010 swine flu pandemic. The rates of ILI were quite high, 46, almost 50%. So we're not quite at that level, but it is unusual. And I will mention that last year during our flu season, We had a peak during the winter. We had another peak in the spring. But what was unusual is we never went down to baseline in terms of our ILI or influenza-like illness cases. And so we're going into this 2023-2024 flu season with already a high baseline of influenza-like illness cases. And so when we hit our peak, which is typically at the end of December, early January, I'm afraid we may see even more cases. And that's my concern right now.
Well, Dr. Christopher Hui, what's your observation? So, are you as concerned as Dr. Tan about the seriousness, and also probably it's yet to peak?
Thank you, and good morning from the Royal College of Physicians and Surgeons in Glasgow. I agree overall with what's been said already by our expert colleagues. Certainly in Hong Kong and Southeast Asia, we've seen an uptick in the prevalence, the presentation of influenza-like illnesses, predominantly subtypes such as RSV, so respiratory syncytial virus, flu A, of which locally we're seeing more of the H3 variants. But again, this is within what we would expect for a winter flu season. I think, as you mentioned at the beginning, because of a reduction in the vigilance of social distancing and mask wearing, for example, together with a degree of vaccine focus on COVID over the last year and the previous months, perhaps the level of awareness and vaccine or immunity cover in the population is perhaps a little bit lower than it would be otherwise, but certainly not outside of our expectations for the season.
Well, Professor Wu, back to you here. Of course, according to the WHO, saying that the spike of cases is caused by common winter infections rather than any new pathogens. I mean, that's probably comfortable for a lot of people to know that. But still, as you said, if you look at the cases and intensity, it seems a bit unusual. Some would ascribe that to the so-called dead immunity, or immunity dead or immune naive, because of over the past 3 years, people wearing masks, basically cutting off the chances of any infection. So somehow people are losing their ability to be immune from new viruses. Is that the case?
Well, I think, I think that definitely is a possibility, but we probably do not know the reason for sure. I mean, it's clearly that in the past 3 years, people basically focused on taking the COVID-19 vaccination, but a lot of people did not take flu vaccines. And also after 3 years of mask wearing, people actually did not have much contact with the flu and the RSV and other viruses. So as we open up the society, open up the restrictions on flu prevention, COVID-19 prevention, definitely when people encounter the flu virus, RSV, and also mycoplasma pneumonia, this probably would give you more infection and more severe symptoms. But I mean, it's good news is that we don't see any new pathogens. If you look at, according to China CDC, that in the small children, like 1 to 4 years old, mainly it's the flu virus and also the rhinovirus. In the young adolescents, mostly actually it's the flu virus and mycoplasma pneumonia, and also in some cases adenovirus infections. So it's actually quite common for this season. It's not surprising. I agree with the previous speakers.
Well, Professor Wu, also WHO official said the current spike in respiratory illness in China is not as high as before the COVID-19 pandemic. Is that a surprise to you?
Well, I think it's not as high as the pre-pandemic period. I think that what we are surprised is that it's the cases are more concentrated within a very short period. So that's why you see a surge in the hospital attendance, and also that put pressure in the hospital. That actually with the situation, and when people are actually have some fevers, they become panic and flock into the hospitals. This is something what we saw. Like in Nanjing, in my university affiliated hospitals, actually many people are just having some mild symptoms. They come into the hospital. I mean, this is just to increase the possibility of getting crossing infections. So I think this is a more kind of, a panic reaction in certain cases. So that's why we give out the advice that when people have a mild symptoms, do not come into the hospital, just rest in the home, take a lot of food, and then, in 1 or 2 weeks, particular upper respiratory tract infections, it will go away.
It will go away. So Dr. Alice Tan, you mentioned about the situation in South Korea, and here we know the situation in China, and Dr. Xu also talked about Hong Kong, situation in southern China. Probably that is not as cold as in northern China. We do hear also other reports like in Denmark, in some parts of the U.S. So it's like it's not restricted to one city or one country now.
Yes, I agree. There, as you said, there are some countries in Scandinavia, Denmark, Sweden that are seeing increases not just in infections, but hospitalizations due to acute respiratory illnesses. We're seeing other regions around the world, Russia, for example, countries that sort of escaped, say, COVID-19 during the pandemic, which would be African nations, that are seeing increases in COVID activity, also other acute respiratory illness activity. I think one of the differences, though, is perhaps not just the fact that we're seeing more cases, but the pattern seems to have changed a little bit in terms of the timing. So compared to previous years, the typical winter surge, say, for example, last year, shifted up. And so it appeared that there were a big surge in cases. But if you looked at the total number, there wasn't so much of a difference. So right now, in terms of the 2023-2024 acute respiratory illness season, things are just getting started. I think we need to see what happens going forward in terms of the spread of infections in different countries around the world.
Well, Dr. Christopher Xu, the Chinese health authorities have attributed to the rise in pediatric pneumonia cases to earlier we mentioned about M pneumonia. Tell us, what is M pneumonia, and what about the symptoms there?
Well, as Professor Wu has already mentioned, mycoplasma and the infections that are affecting certain populations at the moment, they often start with a viral upper respiratory tract infection or an influenza-like illness. From our perspective, this is very much population-based, and I think a big factor for respiratory pathogens and the transmission is related to population density. So previously, where you were looking at all other areas of the world, I think a lot has to do with the prevailing density of the local population, and so places like some of the primary cities in China and Hong Kong as well, where we track through our Center for Health Protection, we do see an uptick in the numbers. Of course, as has been mentioned already, a lot of this is treatable. The patients are recovering, and they're recovering well. And so really it's down to the health services and our colleagues to take good care of these individuals, these patients who present to hospital. Again, I think it's important to stress that this is within our awareness of what is expected for a winter respiratory season. And I think what really is quite different this time compared to, say, 3 years ago is the awareness at the patient side. So family and members of the public will be very aware to present early. But also that our diagnostic techniques are much improved now. So we have PCR, so rapid testing, and polymerase chain reaction, which allows us to pinpoint the respiratory pathogen almost within a few short hours of presentation. So for my own patients, for example, when they come in, we can do a PCR panel, and we can normally pinpoint the respiratory pathogen very quickly. And I think that's changed dramatically in the last few years.
So that's obviously reassuring for a lot of people, I guess. So Dr. Alice Tan, do you see, let's say the principal factor behind the rise of the infections, either in China or South Korea or other parts of the world, they are the same with so-called like M pneumonia?
Mycoplasma pneumonia, we do see cases like that. Here in Korea, we saw a pretty big surge in influenza cases among children. And what was a little bit unusual is we had cases of what we were calling stealth pneumonia, stealth influenza. In other words, the child was infected with influenza, and instead of having the typical symptoms, all of a sudden, high fever, muscle aches, headache, maybe some gastrointestinal symptoms like diarrhea, they had a lingering cough for several days, and they felt really not too bad. And so the problem, of course, is when you have this sort of what we call a walking pneumonia or picture, they're infected and they are infectious, but they feel well enough to be in the community. They are going to school, they're going to daycare, and then, of course, they're spreading the infection widely. And so we did have a picture earlier, end of October, where there were some schools where half the students were missing because they were out with the flu. In terms of mycoplasma cases, similar in terms of what we're seeing. Mostly they are mild self-limited cases. I will mention, however, that we need to be very careful about mycoplasma pneumonia cases that may have antibiotic resistance. That has been noticed, including in China. And so if there's a case where it just, the child is not responding well to what we would consider first-line antibiotics, that is something to consider. And we want to make sure that we don't have a spread of mycoplasma that has antibiotic resistance, because it makes it more difficult to treat.
More difficult to treat the disease there. But before touch upon the resistance part, Professor Wu, I want to ask you, like in the Chinese situation here, earlier you mentioned about not only children but also adults, they are affected, obviously by the either virus or bacteria here. Of course, people call it walking pneumonia because yes, you may get affected, but you can still work. You have a normal life. It's not serious to be hospitalized. What about the Chinese situation? Is there anything unusual about the infection?
I don't really see anything unusual. It's mostly pretty much as what we expected. Most of the people actually have developed mild symptoms like coughing and fever, and also tiredness, dizziness as well. So otherwise, in the first few days, actually, some patients actually develop a kind of short breath. Overall, I think those symptoms are quite common. Although this time, the people who I know actually develop getting infected, actually sometimes they have recurrent fever. This is something actually seem to be something we did not see before. So. But as far as I know, in the clinic, that people are mostly recovered within 1 week. So I guess this is pretty much normal. When they take a test, most of them actually are either flu or in some children the RSV infections. And I haven't seen in the adults they have mycoplasma pneumonia infections. In children, they do have rhinovirus infections as well. So mostly those are acute upper respiratory tract infections, although few actually develop a more severe lower respiratory tract infection and lung infections too.
Well, the good news is like it's treatable and it can be treated. Dr. Tan, as you mentioned, but you talked about resistance to medicine. What do we have available right now? I guess you talk about the situation in South Korea. I mean, in China, Chinese doctors are also talking about or warning that the resistance level, for example, in China is pretty high. 70% or 90%. That's really worrying. A concern. What's the response? What's the advice? probably for the medical community or for the parents, in terms of reduce this kind of resistance there?
Right. So there's a concept called antibiotic stewardship. In other words, both patients and the medical community, we need to be responsible when we are prescribing antibiotics, and also when we're taking antibiotics. So we say it's important to take the right medicine, the right dose for the right duration. There was a concern that people got word that an antibiotic such as azithromycin was the right treatment for mycoplasma. And so anytime a person felt a little bit sick, like they had a cold, they might be tempted to take azithromycin, but it may not be, their infection may not be mycoplasma. It might be a viral infection. And so they're taking the wrong treatment and then increasing the probability of a resistant strain happening. And so this is a really important message, is people should not take antibiotics or antiviral medications without consulting with a physician first. And when you do get prescribed, make sure you take it the entire course for the prescribed duration. Don't just stop in the middle if you feel better after 1 or 2 days, because that's not going to be enough to completely kill off the pathogen, the bad bacteria or the virus.
Mm-hmm. Dr. Christopher Hsu here, what's the usual treatment, or what's the practice? We mentioned that probably we have the antibiotics to treat the disease. And at the same time, what about the resistance rate, for example, in where you are in Hong Kong? Is it any different from other parts of China or other parts of the world?
Yes, so the first thing to say is I think I agree with what Dr. Tan has said already about antibiotic stewardship. This is very important wherever we work and wherever we live. And certainly China and Hong Kong has made great steps in this direction over the last decade in reducing the use of antibiotics in the secondary and tertiary care settings, and extending out to primary care now as well. In terms of studies from the 80s and 90s, we were aware that Mycoplasma pneumonia had resistance levels to a specific class of antibiotics called macrolides that went up to, as you said, about 70 to 90% in different studies in different communities. And so we've been aware of this problem for some time. As my colleagues have already mentioned, what is really important is that we are treating the correct condition, and that we have the right diagnostic tools available to us now, so that we're not over treating, for example, viral upper respiratory tract infections with antibiotics. Certainly in my time as chief of service at the University of Hong Kong Shenzhen Hospital in the southern part of China in Guangdong province, we took the headline rate of antibiotic use stewardship-wise from about 14.9% of all patients coming into the hospital down to about 7.8%. So halving the level of antibiotic use in the prevailing presentations. Now this was not measured or studied during a peak sort of winter season, but certainly I think the principles are sound, and that I know my colleagues are very aware of this issue, and that they will be practicing very carefully not to overprescribe antibiotics.
Mm-hmm. Zhiwei, Professor Wu, what's the situation in the mainland, for example, in prescribing the antibiotics, in avoiding the overuse, for example, or the abuse of antibiotics by the patients?
Well, I think in the mainland, the use of antibiotics now is much better guarded than it used to be. So basically, what you can see is that because the hospitals utilize all sorts of diagnostic tools like PCR, as Christopher just mentioned, that so they could pin down whether this is a bacterial infection or viral infection. So that actually give the physicians a tool, to prescribe whether patients should use antibiotics or just use antivirals. So this is a tremendous advancement in terms of of limiting the drug-resistant bacteria. The other thing is that I noticed that in some clinics or in some settings, people utilize the point of care diagnostic tool, which actually is much less sensitive and accurate. Like POCT, what we call it. People utilize that for flu virus detection. So basically, we know that POCT for flu detection is very insensitive because it's only very low percentage. Some study shows that only 20 or 30% actually can be detected. So when people utilize that kind of test method, when they turn out to be negative, they thought, okay, I'm bacteria infected, so they take antibiotics. This is a bad thing in terms of limiting the drug-resistant bacteria. So this is very important for people to take accurate, reliable diagnostic, and then make their decision to utilize antibiotics.
Dr. Tan, a final words. We couldn't overstress the vaccination vaccination during the pandemic period for people to get vaccinated. Now we are facing different bacteria and viruses, RSV or the influenza or other kinds of bacterial viruses. Do we still need to do the same vaccination? And also, what's your suggestion for parents who are worried about their children?
Right. So vaccination is the best way to prevent infectious diseases caused by viruses. So we're talking influenza. I think China may soon have a vaccine against RSV. My understanding is that it's in development. They do have it in the United States. And then, so influenza, RSV, these can be prevented very effectively with vaccination. And so getting that message out to parents in terms of it's important for the child to go in for their well baby, well child visits and get their what we call their routine childhood vaccinations, but don't forget the seasonal illnesses as well. Even though people may feel a little bit of vaccine fatigue because we've spoken so much about COVID vaccines, it's so important not to forget about these seasonal respiratory illnesses that can be prevented. And so for infants 6 months and older, for children who are school age, making sure that they are vaccinated for flu season is very important. And I know China, they are making a big effort in terms of making these vaccines more accessible by having mobile vaccination centers actually going into schools, going into community centers to help with people who have mobility issues, the elderly. They are at high risk for influenza, so mobile vaccination units are very helpful. But full participation and awareness in these vaccination campaigns is really the best way to prevent these severe respiratory illnesses. For mycoplasma, it's a bacteria. We don't have a vaccine against it. We just need to use well-known preventive health measures, washing your hands, avoiding crowds, masking if necessary, making sure that the indoor spaces are well ventilated. And these measures, we know they do go a long way to help prevent the spread of infectious diseases.
Well, with that, we come to the end for today's show. Many thanks to our guests. You can also find us on the CGTN app on YouTube. Thank you for being with us. I'm Xu Qingduo. See you next week.